I take terrible offense, Greg, that you've likened the Obama campaign to radiation therapy. So, in all seriousness, though, there are many issues that I would like to address in regards to government and health care. Before I speak on health care reform, I first want to update you on some recent events within the administration that are personally causing me great concern. One of these is the decision to reinstitute funding of the UN Population Control Committee. The Bush administration had done an investigation of this committee within the last decade. They found that it was funding forced abortions. Pro-life people are against forced abortions. Pro-choice people are against forced abortions. And yet, shortly after entering office, the Obama group reinstituted funding of this program without even investigating first to see if this practice was still continuing. That means that U.S. tax dollars are likely being spent on something that virtually all Americans oppose. Another issue being discussed is the institution of the Freedom of Choice Act, which was introduced in 2004 initially, but didn't even make it past the subcommittee level. Although this sounds like a nice title, what it really should be called is forcing physicians to go against their conscience and against the Hippocratic Oath, which the Hippocratic Oath in its full form does prohibit, quote, use of a pessary to induce abortion, end quote. The argument they are making is that women who are denied health care. This claim is completely unsupported. With rumors like this, forcing people to physicians and hospitals to go against their conscience, Catholic bishops have threatened to close Catholic hospitals nationwide if this act becomes law. I ask you, what would that mean for our community as our local Catholic hospital closed its doors? According to Dr. David Stevens of the Christian Medical Association, quote, the real threat to healthcare access is driving out every healthcare professional who conscientiously practices medicine according to life-affirming ethical standards, end quote. Another issue that Obama has announced is that he will sign an executive order requiring federal money to be spent on embryonic stem cell research, removing all the restrictions that were placed by the Bush administration. Now, let us switch gears for a moment and discuss health care reform. Why is this such a hot topic? There are many reasons. One generally stated reason is that there is a significant proportion of the population that is currently without health care. However, it is estimated that approximately 1/3 of these individuals actually qualify for Medicaid programs and state health insurance programs if they bother to apply. However, they don't. Another reason becomes readily apparent when we consider the federal budget predictions of costs of current federal health care programs. Currently, the federal government pays for 1/3 of the nation's health care bills. In 2008, about 25% of the total federal government spending was on its health care program. This does not include the tax credits to subsidize private health insurance to the tune of over $260 billion. By the year 2030, with the advancement of baby boomers into retirement, the entire income of the federal government will be spent on Social Security, Medicare, Medicaid, and just the interest on our national debt. If these programs continue to operate under their current conditions, that leaves no money for education, law enforcement, military, or anything else. It is clear that some action must be taken. What action is the question? Many are in favor of adopting socialized medicine. In view of this, I will add several cautions. Some things we have seen internationally must be stated. Although we currently view life as priceless in this country, the health plan administrators will quickly come to view a life as only worth so much. Any decision to treat will not be based on what the physician thinks is best or what the patient wants, but will be based on the cost effectiveness of any particular treatment and on what the health care plan allows. This will likely mean that treatment will be denied based on a patient's age, diagnosis, and other health issues of the individual. You may think that that will not happen in the land of the free and the home of the brave, but let me tell you, it already has. Just ask Barbara Wagner, an Oregon woman suffering from lung cancer, who was notified by her state-run Oregon Health Plan that their policy did not cover the life-extending cancer drug that her physician had recommended. The insurance company did inform her, however, that the health plan would cover physician-assisted suicide. If we look at other countries with socialized medicine as a model, we can see long waits for elective and emergent procedures as well as simply for hospitalization. According to the British government, at any one time, there are about 1 million people waiting to get into the hospital. According to the Fraser Institute, almost 900,000 Canadian patients are on the waiting list at any point in time, and in New Zealand, 90,000 people are waiting. You may have also heard that there is no difference in the overall mortality rate between countries with socialized medicine versus commercial health care. Although while looking at the community as a whole, this may be somewhat true, but let's look at areas where we know early intervention makes a difference. For example, breast cancer. Among women who are diagnosed with breast cancer, only approximately 1/5 will die of their disease in the U.S., as opposed to 1/3 in France and Germany and almost half in New Zealand. This makes complete sense. First of all, screening mammograms are delayed, long waiting lists to get in and have your screening mammogram done, 6, 12 months. Then if something is detected, you're waiting another 6 to 12 months to see the surgeon, and then waiting again to have your surgery. As a result, the cancer continues to grow and grow. This makes perfect sense. Among men who are diagnosed with prostate cancer, fewer than 1/5 die in the United States, as opposed to 1/4 in Canada, almost half in France, and over half in the United Kingdom. Although there are many more issues to be discussed, for the sake of time, I will conclude. Overall, we see on the horizon very major changes in healthcare coming. We must be very careful and think through the issues completely. There is no quick and easy answer. The key is to appoint leaders of integrity, whom we the people trust, to listen to our voices and to implement what is indeed in our best interest. Also to note is that, as with any role that we wish the government to fulfill, we must provide the resources for the government to accomplish this. There is no such thing as free health care. Thank you.